Number one is education and the ability for us to teach our residents and teach physicians how to operate and how to diagnose patients using a multitude of tools that are available. One of those tools I think that's right around the corner is AR and VR, augmented reality and virtual reality. The ability to say look at a patient and hopefully be able to kind of peel back the layers and be able, for instance, maybe perform a virtual surgery on that patient. Even for those patients or for those physicians who are in distant areas who don't necessarily have the access or the equipment to be able to treat some of those patients, perhaps we'll be able to use AR and VR to invite visiting or teaching surgeons to assist them with those procedures. And then this idea of using AI or artificial intelligence to help not only physicians but also help patients maybe identify sources of what's causing them pain and what's causing them discomfort. And then lastly, robotics. There's been a huge push within the last couple of years to introduce robotics into the operating room. I'd like to think that use of a robot is an adjunct, meaning it allows a surgeon to provide hopefully better care. The hope is that you have a good surgeon who's now made even better with the use of an assistive device such as a robot. And all these things I think are going to really develop over the next several years. I think we're still in the infancy of a lot of this technology. Certainly augmented reality and virtual reality has been around for a number of years, but I think in the next decade or so we will see that merge into the operating room. We're already seeing it being merged into our day-to-day devices such as our cell phones, and it's becoming more and more mainstream. AI is being talked about pretty much almost on a daily or weekly basis by not only us as educators and physicians but also the general public. So I'm really excited as more and more people are being exposed to these different technologies. We'll have an influx of different applications that will be put forth in the operating room and even in the clinical setting as well.